So welcome everyone to join our elections. And today we have a candidate, president and vice president candidate who present their idea and their future contribution to the AHLA development. And I will give Professor Peter Chang to introduce the rules of the elections. So Professor Peter Chang.
Thank you so much, President Tan, and all the good friends. We set up an election committee decided to set up last year, and we start to work on in March and make announcement. We are very happy. A lot of good friends they would like to help or to manage the AHLA. Let me introduce our vice chair. We have a committee with 5 people. Myself volunteer to be the chair, and vice chair is from Philippines, Carmen Tolabin. Unfortunately, this afternoon she sent me a message that their internet is breakdown, so maybe she will join us later because I'm going to share with this chair with her. And we have President Duan certainly in the committee member. It's very, very important. And we have Tin Tin Su from Malaysia. She was vice president of AHLA, very important member. And we also have Dr. Quay from Hanoi, now in Hanoi. Before was in Haiphong. He was vice president. So you see the committee is all the present or past president or past vice president as a qualification. Right? So we have 5 members, and we set up all the regulation and rules, and all right. So and we open, and we are very happy to receive all the nominations. Another thing is the timing, because after today's presentation, we're going to start the election process by the Secretariat from July 1st. So expect from July 1st, the member will receive an email of survey that all the member can cast the ballot. So July 1st, about 6 days. And so from now until July 1st, and then even before closing of the July 6th as a closing of the ballot. I hope in 6 days we have all the members will cast their vote. And every member can cast 1 vote for president, 3 votes for vice president. Okay, and we expect to have 60 to 70, at least 60 to 70, or the best will be 100% turnout that all the members will cast their choice and selection. So today's event is very important. We know who will be our next leaders from 2027, beginning of 2027 until end of 2028. Very, very important next term. And all the candidates, once they are elected, they will start to work with the current president, vice president, secretary general to run. You have 6 months to prepare to take the presidency from January 2027. So I think I finished my explain about the job. Today is and the sequence is a random sequence, depends on who choose the time. And everyone, I expect to have 5 minutes presentation and 5 minutes of Q&A, mostly coming from the election committee, but could be from member. And if we still have time, we can open up for anyone on the website or on this open presentation to ask question, but likely short question. And if the question is not appropriate, I and Carmen and committee member would try to intervene. Otherwise, we will open for everyone to ask the question. So today's those online could be some of our past our advisor from USA, from Europe, from every, we invite all those people working in health literacy to join. Very, very important presentation. Well, this is to make the candidate a little bit nervous about what we're going to do. Okay. Anyway, President Tan, did I explain everything? Anything you want to add or supplement?
Very well done. Thank you very much. And Peter Chung is the founder, and he know everything about health literacy and also the AHLA. Just now we update. We have a 21 member. Some already confirmed pay, and some are already paid, and some is paid on site, and some coming. So we will confirm all of the member lists by end of this month, and we start to vote next month, first week of next month. Yeah. All right. So should I give the mic to Peter?
Oh,
So Peter will share the
yeah.
section. Yeah.
So now I think we are ready. And first, I would like to invite Samantha Thomas, our good friend, to make. And you have 5 minutes, and hopefully plus minus 1 minute. If you go a little bit, we would expect you can finish by 6 minutes. All right. Thank you. You are very welcome.
Thank you. Thank you both so much. Hi, everyone from Melbourne in Australia. Before I start, I'd like to acknowledge the Wurundjeri people of the Kulin Nation, who are the traditional owners of the land from which I am joining you from today. It's a real honor to present to you today. I first learned about AHLA last year when I came to one of your wonderful conferences in Taiwan, and was so impressed with the organization, and knew that this is something that I would like to be involved in further. So what I thought I would do is just tell you a little bit about me and who I am and what I do, and then some of the areas that I think I could contribute to in strengthening some of the things that I saw from AHLA last year. So first of all, who am I? I am a professor of public health at Deakin University. Before I became an academic, I worked at the World Health Organization in Geneva, where I worked in mental health and Indigenous people's health. Now I work mainly in the commercial and political determinants of health. So I work at looking at how industries impact the health of communities, and then what governments do in response. And I have a particular interest in critical health literacy. And I'm also editor-in-chief of a journal called Health Promotion International, which is the leading health promotion journal in the world. We are a Q1 ranked journal, and we just have had our latest impact factor released, and we have an impact factor of 3.6 now. So we are a very well-standing journal, and we have a number of members of AHLA on our editorial board as well. So I had 4 things, and I will promise I will finish within 5 minutes, that I thought I would be able to contribute to AHLA. The first is, you could see at the conference last year the real engagement and potential from our PhD students and our early career researchers at the conference. And so one of the things that I thought I would be able to contribute would be to help you expand and develop on your mentorship opportunities, linking ECRs in the region with other established researchers in different parts of the world. So particularly here in Australia, but also with our colleagues at the WHO and other areas in Europe and beyond. And one of the things that we're able to do with our capacity here in Australia is to offer a range of practical training workshops, particularly in relation to qualitative methodologies and mixed methods, which we know are really important in terms of career progression, but also in making sure that research makes it into very high impact journals. We can also offer here, and I can help support grant writing, publication skills and career development, and to also try and facilitate some international collaborations and cross-country collaborations, particularly here in Australia, but also in New Zealand as well. I'd like to make sure that we promote lots of opportunities for early career research leadership within the association, and to make sure that we have a real supportive and inclusive research community, lots of information sharing and collaboration. The second is that I would really like to help strengthen our focus on critical health literacy. This is an incredibly important and growing part of health literacy. And what it does is it strengthens our understanding of the commercial and political determinants of health and supports work focused more on empowerment and participation in health. So this really, I think, is something that we are definitely seeing grow in countries like Australia. And it would be great to strengthen some of the training and collaboration around that through the association throughout Asia. In my role as editor-in-chief of Health Promotion International, I have a real ability to open up publishing opportunities for members of AHLA and to create pathways for researchers across Asia to publish and disseminate their work. And that can include developing special issues on emerging health literacy priorities, supporting authors through writing workshops and publication workshops. We have special initiatives for early career researchers at Health Promotion International and lots of mentoring and support. Also in terms of seeing how journals work on editorial boards and through some of our peer review processes at the journal. And also to help us build stronger partnerships with journals and publishers. So it would be great, for example, to see AHLA become a formal partner with HPI, for example. And then finally, we are seeing definitely in many parts of the world that there is increased innovative research translation initiatives that are starting to be developed. Here in Australia, we are using social media extensively to help translate our research to communities, but also to help build capacity in other researchers. So we actively are starting to use podcasts and videos, digital resources, Instagram pages and so on to reach a much broader audience. And I think the association can play a really important role in being champions for health literacy using these new innovative digital platforms. That also can help strengthen our partnerships with governments, with non-governmental organizations and community organizations, and really bring people into our processes to share tools that can help maximize our research impact. So that is they're my key areas of focus. I think I would be best placed in the scientific committee, in the different committees that we had to nominate. But I could also work in the membership committee as well to try and encourage more people to join this great organization. And hopefully I stayed within time, and I'm very happy to take your questions. Thank you.
Well, thank you so much, Samantha, that you have put a very on time. I don't know, we have quite a few people from a different area. I would like them to put on the question on the chat. That easy, we can know how many questions will come to you. I haven't seen any question and there's no hand raised. Maybe I have the first job question. I know in Australia already done a lot on health literacy promotion. You know, one of the best example. One of the questions we have been asked that do you think top-down or bottom-up strategy, which one is more preferable in Australia, and how do you see that is having some advantage to promote health literacy?
So what we are definitely seeing, not just in health literacy, but in most of the areas that we work in health, is that we are bringing together communities with researchers in co-design and in community partnerships. So particularly with lived experience groups, with young people, where they're playing a much more active role in shaping research projects, but also in shaping how we translate our materials back to communities. So for me, maybe it's not top down or bottom up, but more how we develop really meaningful partnerships with the communities that we work with to create research, but also to implement some of the health literacy strategies that we're developing as well.
Thank you. Thank you for very good answering that. We have Maria from Brazil. She kindly posed a question. Let me read that. I'm Chris from Brazil. My question, Maria's question. why should we focus on changing individuals' behavior rather than adapting scientific methods to different local realities? Would you like to respond to the question?
Yeah, sure. So what we know from basic public health approaches is that we need multiple levels of intervention. So we need to help empower our individuals, but we also need to work to change the systems and structures in which those individuals live, work, play, and love, which are the core principle of the Ottawa Charter for Health Promotion. So for me, individual empowerment and capacity building is very important, but that must be supported by making sure that we are addressing the systems and structures in which people are working and living as well.
Okay, good. I hope this answer to Maria's question. I don't think any additional question. I'm opening the floor to all. We have 3 minutes. Duan, please, the president. Duan.
Hi, Sam. Great to hear your sharing. In the last point you mentioned about you can also involve in the membership development. And what's your plan and strategy to attract and more members from Australia, New Zealand, and other parts of the world? Could you please share your plan?
Yeah, that's a great question. First of all, I think if people knew about the great karaoke at your conferences, then more people would come along for sure, and how fun your conferences are. But I think actually one of the things that I think maybe we can work on is how you get more visibility in Australia and New Zealand. So one of the things that we know from working at Health Promotion International, for example, is that this is a very crowded field, and we have to use lots of really engaging and innovative strategies to cut through all of the different information that people receive about lots of different things. So having a really strong social media presence, showing people what AHLA can do, showing people the benefits of being involved in AHLA, I think will really start to raise the visibility of the association, but also to show the great work that's being done and actually what we can achieve through the partnerships across countries. So for me, I think it's actually starting to raise the visibility through platforms like LinkedIn and Instagram, just really profiling not only the great work of the members, but the great work of the associations as well.
Thank you.
I see any last short question from the floor? Well, apparently you have made everybody happy about your presentation. So thank you so much, Samantha. I hope you will stay to listen to other candidates.
I would love to.
Yeah, and now if I can move to invite to the next speaker from Haiphong University of Medicine and Pharmacy, from College, Dr. Professor Ran Hai. Hi, Dr. Ran, Dr. Hai, if I can. Actually, we are very, very happy that because Haiphong University of Medicine and Pharmacy organized the fourth AHLA conference in 2016. It's exactly 10 years from now. I'm very happy. I believe by the time we were there, you are very young, very inspiring. But we are very happy that you join us to the vice president candidacy. So if I may, the floor is yours, and you have 5 minutes. Thank you so much, Dr. Hai.
Yes, thank you, Professor Peter Chang, for introducing me. Good afternoon, everyone, and college. Really sorry because I didn't prepare my presentation, my slides, but I will try to introduce slowly and in detail. It is a great honor and pleased to have this opportunity to introduce myself and to express my interest in serving the Asian Health Literacy Association, AHLA. My name is Nguyễn Thanh Hải, and I am lecturer and vice dean of Faculty of Public Health at Haiphong University of Medicine and Pharmacy in Vietnam. So I am a lecturer and public health researcher with 15 years of experience in teaching, research, and academic leadership. My academic training include a Doctor of Medicine degree, a Master of Tropical Medicine and Global Health, a Master of Public Health, and a PhD in Public Health from the University of Angers in France. Throughout my career, I have a focus on epidemiology, occupational health, preventive medicine, and community-based interventions. I have authored more than 50 peer-reviewed domestic and international publications and have participated in numerous national and international collaborative projects. So I think my research interests are closely aligned with AHLA missions. What particularly attract me to AHLA is its mission, promoting health literacy as a key strategy to reduce health disparities and improve healthcare quality throughout Asia. In many Asian countries, including Vietnam, strengthening health literacy is essential for achieving equitable and people-centered healthcare systems. About my history with AHLA, like Professor Peter Chang introduced, I first became acquainted with AHLA in 2016 when the fourth AHLA International Health Literacy Conference was hosted by our university in Haiphong. At that time, I had the opportunities of contributing in a small way to the organization of the conference, and through that experience, I witnessed the remarkable scale and influence of AHLA, not only across Asia but also globally, and I came to appreciate the important role that health literacy plays in improving people's lives. So what impressed me most was not only the excellent research presented at the conference, but also the way health literacy research will translate into education, into policy and community practice to strengthen the health capacity of diverse populations. I was also inspired by the commitment and vision of AHLA and by its long-standing contribution to advancing health literacy over the years. A little bit about our university. Although our university is a member of AHLA, I believe that there is still large potential to further integrate health literacy into health professional education program. And we can also expand research activities and most importantly, translate evidence into practice and policy to benefit communities. If given the opportunity to serve, particularly as a member of the scientific committee, I would be honored to contribute to strengthening AHLA's academic network and promoting collaboration among researchers, educators, and public health professionals throughout the region. I also strongly believe that scientific evidence should not remain within academic journals. Rather, it should be transformed into educational program, community intervention, and policies that improve people's health and well-being. So my vision is to help connect health literacy researchers across Asia, foster multidisciplinary and multinational collaborations, and also promote large-scale study with meaningful and sustainable impacts on communities. Together, we can bridge research, education, and practice, and ultimately contribute to building healthier, safer, and more equitable societies. So it would be a responsibility for me to serve AHLA and work alongside colleagues who share the same commitment to advancing health literacy for all. So thank you again for bringing this opportunity to me. Thank you so much for your listening my presentation, and I sincerely appreciate your consideration and look forward to contributing to the continued growth and impact of AHLA. So thank you again.
Thank you so much, Dr. Nguyen Hai. I know we have a committee member from Dr. Quay and maybe Carmen, or if you have any questions, the floor is open for you.
Thank you, Professor Peter Chang. And I don't have a specific question for him, but I support him very much as a colleague working at the Haiphong University of Medicine and Pharmacy since long time. Hai has his characteristics of leadership and very active in his way in many committees and associations around Vietnam. So I think that he's a good one to participate and to strengthen the leadership for AHLA in the next few years. So that I strongly recommend his candidature. Otherwise, I think that we have very many strong candidates as well, but I think this is the one that we can count on. And so I don't have much question, but just saying that he need to rather to have his resources to participate in international activities when AHLA organize different meetings and conferences around Asia. That's the one he need to solve, and I think that he has he's in different research and training projects that can have resources to help him to participate in different way. I think so. Thank you.
Thank you so much, Dr. Quay. Now we have Maria from Brazil has a question, and I have a question after that. So let me read Maria's question. Vietnam is a country rich in cultural, linguistics, social, and geographically diversity. From your perspective, which communication strategies and intervention models should be prioritized to reduce health literacy inequities across such diverse local contexts? It's a long question, maybe a little bit tough. So I'll let Dr. Hai to think 10 seconds. My question to follow is that we have very strong player in Vietnam. We have a Haiphong, we have Ho Chi Minh City, we have Yong Da, we have Hanoi. Do you have any strategy to cement to put all these strong health literacy activity and interest together as a vice president of AHLA? So that's my short questions. So Dr. Hai, are you ready to answer?
Yes, thank you for your beautiful questions. So for question from Dr. Chris from Brazil, Vietnam is, like as you said, Vietnam is country rich and in culture, in linguistic and social. For which communication strategy and intervention model should be prioritized to reduce health literacy equity? So I think there are some communication strategy and health literacy intervention should be tailored to local context and developed with communities rather than for communities. So first one, I think communication should be people-centered and culturally sensitive. Health information needs to be, I think, delivery in plain language using local language and culturally appropriate message. Secondly, community-based and co-design intervention model should be prioritized. And the third one is health literacy should be integrated into educational setting and healthcare system. So, for example, in our university, this content is not much integrated in education program. So we can mention this content in the educational program. And the fourth, digital health literacy deserve increasing attention. So why digital technology provide big opportunities, we must ensure equitable access and support for population with limit digital skill, older adults, ethnic minorities, and people living in remote areas. And finally, I think I believe that reducing health literacy inequities requires multi-sectoral collaboration, including researchers, educators, health professionals, policymakers, and community organization need to work together to translate evidence into policy and intervention that address social determination of health and also empower people to make informed decisions throughout their lives. So that is my answer.
Are you also prepared to answer my short question? How are you going to merge cement all the interests from Vietnam together?
I think I merged also the answer for one question.
Okay. All right. We have 2 minutes. I know you probably have some question from the floor. Any other questions you want to put on Dr. Nguyen Khai?
All right, great. That Dr. Hai is fluent in French, right? And now you speak English. So that's great to have a French English pronunciation. Great that you shared. You have a very clear mind about how to promote health literacy, and so how to integrate health literacy and how to transform and translate health literacy into education practice policies and others. I still have only one question. How are you going to develop the membership from AHLA, and what are the strategies to attract more people and activate though already inactivated? Yeah.
That is a really nice question. So I think the same for the first candidate. I think now we have many approach. Can be recruit more members and others, such as via conference, via social media like link or Facebook or others social media. And also we have many research collaboration with foreign college in outside of Asian. For example, in Europe, we can discuss with them about the AHLA, about the vision, about the mission, and we can together with them we can find a way to concern them into our association.
Okay, so thank you so much, Dr. Nguyen Khai, again We just run a little bit out of time, but thank you so much. And you are very welcome to stay online to listen to the other presentation. Now, I would like to invite the next speakers, Professor Dr. Annie Rajmani. Well, Dr. Annie Rajmani has been one of the earliest participation in AHLA in 2010, right? When she came to Taipei for her master and PhD. I don't know, the master and PhD, and she is conducting all health literacy research, even back to Indonesia, huge country in Semarang. And I think Dr. Duen and myself also visit Semarang at least once. So Dr. Annie Rajmani, the floor is yours.
Thank you, Prof. Peter, and good afternoon, everyone. Thank you for the opportunity to share my presentation. Let me
Yes, we can see it now. Thank you.
Okay, thank you. Let me introduce myself. My name is Annie Rahmani. I'm from Indonesia. I'm a Dean of Faculty of Health Science, Universitas Yanuswantoro. I'm also engaged in infodemic manager and related how to manage misinformation and disinformation. I'm also involved in research center of health literacy and health innovation in health promotion in my campus, and also I chief editor of AHLA. Like Prof. Peter mentioned that I'm earlier person that joined AHLA. We have become AHLA Genus Secondary Office since 2013. And we are one of the institution that together to make a health literacy survey around Asia. What I have done during my journey in AHLA, I developed like a website related how to promote AHLA in my country with Bahasa. I'm also make like social media in AHLA, and health literacy is very new in Indonesia, so not many person conducting research in health literacy. So we are developing some of questionnaire that can improve, invite, and can be used by our colleagues in Indonesia related health literacy. The questionnaire can be used free. I hope that it will make health literacy more acknowledged in Indonesia. We develop website that are sharing the questionnaire. And to make health AHLA and also health literacy can be accepted as like common people. We also develop like a website that we change the research paper become like a plain language summary that can be understand by people that's not in academician, but common people to know about research related health literacy. We have like many cluster like digital health literacy, media literacy, disease literacy. So we make like research paper is more acceptable by people with no academician background. And also we try to acknowledge AHLA and also health literacy by developing a journal like International Journal Health Literacy and Science. And this is a new journal, and we association with AHLA also. That with Samantha, maybe she can guide me to increase the impact of the journal also. So what I propose for strengthening the AHLA is that I think member of AHLA is not much engagement. So maybe we can make like some activities that make AHLA member more engaged in the AHLA. Like we like conduct a routine meeting between members, and also we can like join research together and publish together, and related that maybe we can like conduct like webinar among AHLA members. So the member it can be speaker, and it can be a text new members to join in AHLA. And for social media, I think AHLA actually have social media, but maybe like we talking about social media is we talking algorithm, and I think it's challenge for us together that how we can make social media more active, so the algorithm can make AHLA posting is more acknowledged by people. That I think, but it need resources that specialize to conduct the social media. I think the most important is we are AHLA member is not only we just join in the conference, but between conference we can make like various activities like we are together in AHLA to make strengthening AHLA in the future. I think that's my presentation. Thank you for the time.
Well, thank you so much, Annie. I'm very happy that you would like to contribute to AHLA, because you have been a vice president of AHLA. We are very looking forward to more interaction and more participation about health literacy from Indonesia. Indonesia is one of the biggest country in the world, and we are very much look forward to making health literacy one of the health priority in Indonesia. Do you have any specific? I'm sorry, I bring the first question. I should, but anyway, my short question is that how can we invite more partners? There are quite a huge number of the good scholars in Indonesia, and the Department of Health, and they're also very active in this area. Last year in Taichung, we have a senior advisor from Department of Health also joined us. Do you have any good action planning that we can invite more Indonesian partners to join AHLA? Thank you.
Thank you, Prof. Peter. That's my challenge. Actually, health literacy is just including in Ministry of Health is just in 2025. So there's starting in that point, many people talking health literacy. So after that, I try invite many university in around Indonesia, from Sumatra, Java, Sulawesi, Papua, to join me conduct research together to make health literacy data national Indonesia health data. And because it's already put in the Ministry of Health, many university excited to join research together. Before that, even though I sent them email, they didn't aware related. So I hope in this September I can collect many data around Indonesia to give like national data, so I can propose to Ministry of Health that this is a health literacy consortium. So maybe Ministry of Health can more involved in health literacy, especially in AHLA. That's my future plan in this. Thank you.
Thank you so much. If I can read another question posted on the chat that from Ran Tao, is the Secretary General of the AHLA. She said that her question is for you is, in your opinion, how would you assess the role and achievements of AHLA in recent years? What key change or improvements should AHLA make to strengthen its impact and effectiveness in the coming years? Thank you. Annie, would you like to respond to that question? It's also on the chat.
Okay, thank you. Just a minute. I think the change or improvement to AHLA made is engagement of the member. I think we should offering more benefit to AHLA member. We have a discussion, many people talking about what is the difference between AHLA member and not AHLA member. I still can join in AHLA conference without I become member. So maybe we should more discussing what is the benefit that we can give to the AHLA members so they interested in AHLA. My challenge is become in AHLA conference by I cannot attack main Indonesian and the culture Indonesian conference is they interesting in conference that index by Scopus. So there is no Scopus. They didn't have a pay from their pocket to go conference to another country. But if they index by Scopus, they run to get to the conference. It's the natural and culture in Indonesia. So maybe different with Australia or Taiwan. So I think it's I challenge myself how get the Indonesian university want to join in AHLA conference. That's I think that's my question. Thank you.
Thank you so much. Well, you receive a question and you also share your question. We have 2 minutes left. Anyone would like to raise a question that Annie can respond to?
Just
Yeah, then please.
comment on the question. Beside Indonesia, what your plan for other setting? We have a lot of countries here, about 10 countries, more than that. Any strategy to develop and also create impact of AHLA on different settings?
I think for another country, AHLA is more acceptable, because of different culture. But I think if we can make regular regular webinar or regular mini seminar that can between AHLA conference, it can attach more people to interest and maybe join as a member of AHLA. I think actually in every conference AHLA, the bigger participant is in the country of where AHLA conference is conduct. So I think we should make engagement between member and maybe conduct a mini seminar or mini webinar that it can engage member and also can attract a new member to AHLA.
Okay, thank you so much.
Very quick, another question.
Yeah,
since you are a very long member already, and my question is that do you have plan to organize the conference in Indonesia in some year, later?
I think I have a plan, but I think if I already successful in infiltrate in Ministry of Health after I can give the national survey of health literacy because it's my weapon to infiltrate in the Ministry of Health. That because I think AHLA conference it needs support mini finance. So I think if I get the support from Ministry of Health, it's very helpful. Actually, when I try to become host AHLA conference, I already tried to get support from my university, but when it get postponed, it's very difficult to get support. And I think it's like in the previous year is Ministry of Health didn't recognize about health literacy. I think in the future, because health literacy become of long planning of Ministry of Health, I think if I can give them the national health survey of health literacy level, they can more attractive and aware about AHLA. That's my plan. Thank you.
Thank you so
Okay.
much, Annie. Thank you for your time, and I wish we can run the AHLA conference in Indonesia very soon. And I think AHLA would like to meet your Ministry of Health to persuade them and to support them. So let us know any such opportunity. Now, because of time, we are a little bit not too much late. So I would like to invite the next speaker. And next speaker is not a new friend, is an old friend. Professor Chairman Tong has been with AHLA since 2016 or 17. I couldn't remember. It's too long ago. Apparently, I met you many for decades. So you are very welcome to join tonight's event and also make your presentation as a candidate for presidency. So Dr. Cherontong, you are welcome. The floor is yours.
Thank you, Peter. Good morning, good afternoon, and good evening for everyone here. I have 5 minutes, but I think I can present shorter because my presentation this is me from Thailand, and I was a former dean at the School of Public Health, Mahidol University. And right now I'm still with Thammasat University for the social gerontology because we have a super aging society coming up, and health literacy with the Thai Health Foundation is also a big concern and project for every province in Thailand. So the development of my experience in health literacy, I can say that I'm the one who advocate national health literacy policy 10 years ago. And we are very happy that this year we're going to host a conference because we think that it's time for us to show and share with other countries of what we have done. So after advocating by the evidence from research that I conducted at Mahidol University, we able to help developing the Thai Health Literacy Association, link up with the Department of Health, Ministry of Health, and also expanding it to every topics in the healthcare, in medication using, in universal health coverage, in school health, in every setting. So in designing it, I was able to facilitate the concept of social capital, cultural sensitivity, and digital literacy into mobilizing not only the community but also different professionals. So at Mahidol University, we require every subject, every courses in every faculties to at least review your program learning outcome and course learning outcome to see whether you have any health literacy embedded in the program and subject oriented. This means that we expect our graduates to be literate in health, no matter what kind of occupation you're going to be. The third initiative that I feel like is very important for us to achieve health literacy in the population, I realize that many times we think that population not literate because they are not able to, but by observation and by discussing and training different groups of people in the professional groups, we realize, and I advocate now, that people will be literate if the professionals literate. And the concept of professional literacy being developed and trying to link up with the quality improvement system for the human development, human resource development of all ministry. So these are three major achievements that I work with Thailand. So in order to be leaders for AHLA, I can contribute with the goal that I have in mind to expand the health literacy practice from the localized pilot projects of each country to a regional global knowledge and network. By having that in mind, I review what AHLA president expectation of the president. I've realized that we need to act as the catalyst to transferring, moving health literacy from the individual capacity building to the institutional, to the professionals, and to the environmental in the society. We should target at the health literate society. With that in mind, I would like to position AHLA to be the primary driver in Asia for achieving the 2030 Agenda for Sustainable Development. And an hour or 2 hours ago, we just been announced to be the number one in the world for the university that conducting sustainable development from the Times Higher ranking. So to make sure that what we are doing, we give importance to health literacy as the driver for the sustainable development. Again, it's not only the health literacy, but the professional literacy will be the moving goal or moving driver for the achievement of health literacy. So I would like to advocate that we, at the regional level, we should have agree upon what should be the health literacy competency of our professionals, and we should focusing on also on the health communication. These are the two aspects that should work together. For the core function, AHLA has the partners in different countries and also offices in different countries except in Thailand. So I would like to start make visibility for AHLA in Thailand, because I have a network of universities all over the country of different levels. So we should at least open up the AHLA office with link up with the university and different ministries. Not only for the, it's for the life course approach for all age group, and also to link up with the global network. So the identity of the Asia health literacy should be presented. And in order to make sure that we can have more members from every countries, I come up with the idea that not only to tell them that you can attend the conference, but you can have a benefit package, different levels for the students, because they're always asking for the tools and techniques and, come up with the research and activities. So the benefit package will motivate them to join at the different levels of their competency. And that's what I would like to develop. Another one is for the knowledge exchange, not only for the conference that we need to work together. And for this year, it's kind of preparatory for me to function as the coordinator in Thailand for the conference in 2026. So I realized that the site visit and the sharing knowledge from practice into innovation also can be proposed, because universities have this can bring the students to visit and have a practicum. So that can be added if we have an inventory list of different projects in different countries. ASEAN University, Asia University should link up and help facilitating learning of the health literacy in different settings with the multiple professionals. I developed this based on the achievement of AHLA on the journal and research focus that I think it's very good. So I just want to compliment on exchanging the project development. So to emphasize initiation that I propose, the professional development accreditation at the regional project by comparing professional skills and in the different settings like health clinical practice, health literate communities, which in Thailand we mobilizing it based on the primary health care and primary care. So the health literate communities link up with the health literate organization. We have the digital system at the DOH, and we also working with the local government to make sure that there would be different training setting in the local area for the health literate settings. So the goal of the country for health literate society can also expand to the regional level. Another one that I found frustrating in monitoring and evaluation the outcome of health literacy. So the concept that our network in the US trying to develop, which we in Thailand also would like to develop that. So we don't have much budget on the conducting research, survey research for the health literacy. So something that will be digitalized and show to the people so that every partners in different segments can see where to work together to improve. And that's what I think it will be something that we are trying to do. And if I can ask participations from all partners of AHLA, that would be wonderful to bring out the regional outcome of health literacy. The last one that I would like to emphasize is to invite all of you to our 12th AHLA conference in November, because as I mentioned that Mahidol advocate for the SDGs. So I really would like all of you to come to see and to plan together with me of what we can do for the sustainable development, because we are having passion with the health literacy. This is going to be all I can say at the moment. Thank you very much.
Well, thank you so much, Chamantong. I see a lot of applause on your presentation. I know time is not too much left, but if I may, as a chair, to ask a question. I know Thailand has, in health literacy development, has been one of the champions. One of the earliest National Association of Health Literacy, 2018, Taiwan has won, and Thailand also have won, and Japan, 2020, you are one of the champions. I know you're going to lead a very successful health literacy program in Thailand, but as a chairman, as a president of the AHLA, would you like to invite other? And do you have any try to invite those around you? For example, we used to have a Myanmar, but shortened. We don't have Lao at all. We have Lao people come. You know, they are very, very important. Yeah, health literacy is also talking about health equity, and so it's very important. Do you have any? I know you have that connection. Do you have any strategy that you can invite those, not as a member of AHLA, but to join AHLA in the near future? Thank you.
Thank you for the question. I wrote one chapter with Chiba University regarding health literacy in the Greater Mekong sub-region. So, of course, we can link up with our alumni who is the leaders in Myanmar, in Cambodia, but the Cambodia is watching out, but for the Laos, you know, and all of this, we have the project under the royal family and supporting neighboring countries. So of course we can activate that network because as I mentioned, I met you in many occasions because I served as the international relations position for many, many years before I get retirement. And that system still can utilize and activate through
Okay, thank you.
alumni network, Nepal as well.
Yeah, thank you so much. I wish you all the good success in your campaign, and I also wish you not retire at all. AHLA will be a new. AHLA will make you a new sprint for you. So I wish you join and wish you good success. Because the time, I don't know who has the last short questions to Dr. Charantong.
I think I have a short question, but the answer could be long. But I still like to ask that because one of your slides mentioned about accreditation. Actually, AHLA mission is also to have health literacy in accreditations program or a plan for the government and also institution. You mentioned about the community organization and nation health literate levels. It's interesting, but how to start and what your time schedules and achievement according to your plan.
You're referring to the accreditation, right?
Yeah.
Okay. Since I realized, working with different professional councils, and I have a pilot project to work with the nursing, with the doctor, with the School of Medicine, with the public health council. So all of this give me the confidence that if we list, different countries may have achievement in some of the professionals. And after we have that inventory, we can think of comparing it to the other region, like the CDC or Australia and New Zealand, and then we can have a meeting in order to see whether we want to focus on what and how are we going to accredit. But for Thailand that I experienced, what I did was that we have the, I don't know whether you're familiar with the quality improvement, quality accreditation of the human resource, and because of that, we have a data set, and that data set, we can give them the certificate at the low level. But if they are responsible for any project and we look at the outcome, if there is a change in the health outcome with the good strategies, that means they're able to have health literacy project skills. With that project, like the rational drug use, right now I'm traveling a lot to accredit whether professionals in each province has the competency, and I wait until maybe a year later to see whether the supervisor of that region able to show the indicators changes in the health outcome.
Yeah.
And if we measure outcome, and reflect back into the development of competency of the professionals, I think that would be the backward design of the accreditation system.
Great. We can have further discussion on this. Yeah.
Yes.
Great.
Welcome to join, please.
Well, thank you so much for Dr. Duane's question and your answering. So again, I wish you good luck and thank you. Join us. Please stay with us for the last presentation. Now we have the last speaker from Haihua Zhuang, Associate Professor in Kasei General Hospital in Taipei. You probably having dance or karaoke before. Anyway, I know Dr. Zhuang has been the vice president only for 1 year because she is adding on voting last year. So she's qualified to run for the vice president again. So Professor Zhuang, the floor is yours.
Thank you, Honorable President Nguyen, Professor Zhang, and all the respectable partners on AHLA. I'm Dr. Zhang from Taiwan, and it's my presentation. Does it? Oh, yes. Everybody can see it, right? Okay. Yeah. My theme today is to bridging health literacy, preventive medicine, and community health across Asia. For today, and thank you for listening to my vice president candidature. I'm from Kasei General Hospital, and I have board certified family medicine physician, obesity medicine, and precision medicine specialist. And this is what I think. I think health literacy is not just a discipline; it's actually a platform. I have been in Taiwan Association of Health Literacy for many years as from the year one it was established. But I'm semi-new to AHLA. I just started joining it for like six months. And for this period of time, every time when I speak of health literacy to a healthcare professional, doctors, nurses, or even pharmacological vendors, most of them look very confused at the first moment. They look so confused. I say 健康识能 in Chinese, or I say health literacy. They seem to trying very hard to get the idea. So it is to my knowledge that not many people are familiar with this concept. But as long as I explain further what it means, and the most importantly, why it matters to this person's career or their specialty, they start to care. So I was in this meeting for a half hour, and I listened to the amazing presentation of Annie and the city. And I heard one of the questions was, how do you make more people join? And I know that is also a very important question to me. I've kept in mind. I think the key is to make relevance, to make all our participants, our partners, and all the healthcare professionals aware that this matters to them. This will help their career. This will help the people they are caring for. This will make their work easier. And health literacy, from my point of view, I have the background of precision medicine, public health, patient empowerment, and clinical care. It is critical connective tissue that empowers people to navigate fragmented healthcare systems and make informed decisions. As a lot of you may know that the national health insurance system is very good in Taiwan. It is almost universal, but still a lot of conditions cannot be cared very well, including obesity. Why is that? Because a lot of things are fragmented, and not only people, but also healthcare professionals sometimes do not have enough health literacy to make the best decision. I started my career on preventive health and community health very, very young, as when I was a student. When I was a medical student, I joined International Federation of Medical Students Associations, IFMSA. And in 2003 in Netherlands, I was elected as Director of Training Support Division. So what I did those years was to train young, not even doctors, we were just students, to engage in medicine, not only clinically, but also to spread our focus on, for example, health literacy on sexual health, on refugee and peace, on public health, and even we discuss about medical education, how it can be changed to better suit our scope. And then I entered Chang'an University as a family medicine physician. In about 10 years, I achieved 5 board certifications, just mentioned before: family medicine, obesity, adolescent health, osteoporosis, and precision medicine. Some say that, oh, you do a lot of things, we don't know what's your focus. But for me, the focus is always very, very clear. I care for people's health. I let them have the ability to know, catch, decide better health decisions on better information. And for example, obesity, osteoporosis, they seem irrelevant to each other, but actually they are both the care of body composition. When someone is aware that when we are aging, the key to health is to keep your body composition proper. For example, not too much fat, not too little muscle, and not too light of your bone, then you are fine with a lot of conditions. That's what I've been doing. And then I pursue my PhD in industrial engineering. A lot of people are very curious why a doctor would go study industrial engineering. Because about 10 years ago, I realized that the scientific method most doctors use, which is biological statistics, I think it is very science-oriented, but it's not very people-oriented. When people are deciding a health-related behavior, it is not just a single factor. It is a very complex combination of many, many factors. And sometimes there is just an optimal solution. There isn't a perfect solution. The models I see in biological statistics are not real in this real world. So I studied industrial engineering because it is a field, it is an expertise raised from when people were having wars against each other. And we have to decide among many, many factors, which decision is the best. There's no perfect, but which decision is best. So that's why I pursue my doctor's degree in industrial engineering. And then also to make health prevention, healthcare more solid and more progressive, I also spent 1 year in Geisinger Medical Center in Pennsylvania, USA, to learn about obesity medicine and genomic medicine. But I was very unlucky. After 6 months of stay, there was an outbreak of COVID-19, and the situation was very, very bad. I couldn't find even one mask or a drop of alcohol disinfectant in a very big area. So at that time, one of the projects that I was particularly proud of is that I rapidly mobilized a team of young physicians across 5 continents and 9 countries to publish a living systematic COVID-19 research during the wartime to try to answer what might be a useful treatment when there was no vaccine, when there was no medication, when we didn't even know much about COVID-19. And I could achieve that research because I had the network developed long ago from IFMSA, and we were still friends. That's why we could have that collaboration. And now I would like to speak for a few track records of mine. The first we already talked about is my 5 specialized medical boards. And the second one is that about 20 years ago, I started a very big community project on children's obesity care. Not only adults in Taiwan are getting fatter, children are getting fatter as well, but a lot of people are not aware of it. The health literacy of childhood obesity is very poor. Even doctors are like so. So I ended up enroll more than 4,000 children, and then we give them different kinds of education, small group discussion, and also face-to-face, one-on-one consultation to the caregivers of those children. The project ended very well. How well? Most schools told them that they decided to integrate this kind of program for their routine education. So we were no longer needed because they decided to develop and do this by themselves routinely over years. And then I extended this successful experience to workplace health intervention, as people think that healthcare is very good in Taiwan, but it is sometimes based on overloading of workplace health workers. So I executed a massive and award-winning dynamic employee fitness program for over 6,000 hospital staff at Chang'an Memorial Hospital. This is what my project was called, and we have this slogan, 运动together, 健康 forever, which was very well known. And because from my survey, I found that doctors and administrative staff, they were the worst with their body size and the metabolic syndrome. Yet doctors are the most difficult group to intervene. So we have to think of something. And one of the things that I learned about health literacy is that you have to make people feel relevant. And you need to make them feel like this is trendy, this is cool, this is what everybody cares about. Then they join. For example, in Chang'an Memorial Hospital, most employees have very high tension against hospital administrative staff because of this high pressure working and the long hour working. So everybody thought we were going to fail. But then I created this atmosphere that the literacy about caring for themselves and exercise and eat well is something very cool and trendy. Everybody wants to be there because it is fun. So for example, for this year, we use Star Wars as our theme. And every year I have different theme. So it looks very sophisticated and very fashionable to be a part of our member. This is another thing. And for this year, we emphasized to exercise for your whole family together. This is the year that with Star Wars theme. And every week we have more than 30 sessions provided for health professionals. And these are some of the pictures that I would like to show you. This is a picture of our annual celebration program. So you can see everybody was very happy. We successfully included a lot of people which initially were not believers of this concept of keeping their health and exercise together. Okay, lastly, I had more than 80 peer-reviewed publications and also received multiple academic rewards. So 2 years ago, I was recruited from Chang'an University to Cathay General Hospital, and our department was established. It is called Department of Community Medicine. Now our department oversees health care for homes, at schools, and in workplaces. Now we cover a lot of medical services that are more like general practitioners. We don't do cardiovascular comorbidities. We don't do something that is very deep, that is hard, but we do something that matters every day to people and to most of people. For example, health checkups, vaccination, and chronic disease control. And for people who cannot go to hospital, we visit them at home. These are all the work of my, and also cancer screening. These are all the work of my department. And I've received many national and global institution awards, including Top 10 Outstanding Young Woman in Taiwan, National Innovation Award twice, Outstanding Workplace Dynamism Award 3 years ago. And I was also elected as Young Executive Leader for International Health Hospital Federation. Also, the Outstanding Alumni Award from my medical college, which is Chang'an University. So what I would do if I could continue to be the president of AHLA, I think the status quo is that health literacy is viewed as important, but a lot of people think somebody else can do it. And I don't have enough time. It is not that prioritized by many healthcare professionals. So the important thing is relevancy. For example, when I talk to one of our members, which is Dr. Lee, some of you have met him just a few days ago in Chiang Mai. I was trying to convince him to join this AHLA family, and he was confused at first. He thinks that he has never done anything about it. I told him that no, you have been doing it all the time because you care for old people. He's a specialist in geriatric medicine, and then his study is mainly about polypharmacy of the old. I say that polypharmacy is absolutely relevant to health literacy. Then he was convinced. Now he's very interested in health literacy. For example, I was talking to Lilly and Novo Nordisk, two of the many big pharmacological companies in the world. I convinced them to fund some of our activities. First up, from the beginning, they didn't think it was relevant to them. But then I told them that the use of GLP-1 and incretin was very broad. But a lot of people don't have very good outcome because their health literacy of utilizing this kind of agent is not very good. So some of them may not find a doctor, some of them may not comply, some of them may use it just for a short period of time, but cannot maintain. So they became very interested in this area. And also as smart medical and AI is very popular now, I used money out of my own pocket recently to develop an app on weight management. Not any governmental funding or any scientific funding, just out of my own pocket to work on this. This is a picture of our TAHLC meeting. And also, I brought my team to AHLA last year in Taichung and had a very good time. So I have 3 strategies to make health literacy a more important and well-recognized topic in Asia. First one still is that make relevance to all the healthcare professionals. And I think when we approach healthcare professionals with different specialty, you need to find a niche for them. And you have to connect people, either people with the same or similar specialty, and let them develop this specialty specific health literacy for this group. Or we find a group which they care for the same kind of people, but from different angles. For example, obesity, but we have endocrinologists, family medicine, we have our cardiovascular specialist, and then we can have some groups that have very specific and substantial involvement. And second is the smart tools that I talked about. Also, I'm happy that I've gained support from my hospital, which have a lot of human and financial resources committed already. Our hospital is going to hold the national convention of TAHLC very soon in this August, and this is our poster and agenda. And then to build a unified multilingual Asian network, I think I already mentioned about my strategy, about establishing groups on specific issues that people on it can think it is relevant. This is thanks to CT and friends in Thailand. I had the pleasure to join the signing ceremony this January in Bangkok. And also, this is Dr. Lee. He's also a member of Kasai General Hospital under my department. He will also be our active partner in AHLA. So to sum it up, I think I have a complete package for AHLA leadership, which is my academic work is rigor, and the global administration, I'm very experienced since my college time. And also my clinical expertise is already well recognized in Taiwan on 5 different board certified certification. And our community implementation is now very broad under the Department of Community of Kasai General Hospital. Also, we have many staff that can support my work at AHLA. So I'm looking forward to work with the year 2027 to 2028. And please vote for please support my candidature for AHLA Vice Presidency. Thank you.
All right, Dr. Zhuang, thank you so much for a very long. We should set up another time for seminar.
I'm
talking
sorry.
about the shaping.
Sorry.
I know the time is a little bit longer, and I don't know whether we have how much, but maybe we open one question to the floor. Who has one question? A short question.
Now, I thank you very much for this seminar presentation. I try to remind you, but that's great. I learned that you are top 10 young women in Taiwan. I wish you would be the top 10 young women in health literacy in the world, and happy to have you to join us. Thank you. Yeah.
Thank you.
Okay, so it's not a question, it's but anyway, thank you so much. I wish you can use your experience in Taiwan and internationally to improve AHLA, to upgrade AHLA. All right, thank you again. Now we have all the presentation done tonight or this morning, and I wish you President Duan will put this post online that others can see. And wish all the candidates prepare for the coming election process. If you want to share something with us, you are more than welcome. And you can ask Dwayne whether you can put on your PPT or whatever. But we have the presentation video done, and likely we can share with all. And in this, I thank you so much again, all the good candidates, good friends. I wish you all very, very successful in your career and your interest in promoting health literacy around the world in Asia. And so it's time to say good night or goodbye, and hopefully all we will see each other in Chiang Mai in November. Thank you so much. Floor is Dr. Duan. Dr. Duan, you have the floor to close it. Thank you.
Yeah, thank you very much, Professor Peter Chan, for chairing this elections presentation. I wish you all a good luck and looking forward to cooperate with all of you in this future. All the best. Thank you. Good night and
Thank you.
goodbye.
Good
Bye.
night. Good night. Thank you so much.
Bye.
Bye-bye.